Hello, my name is Ken Dolan. I am a patient of Dr. Kaufman's. I had surgery in his office in 2022. Somewhere around 2014 or so, when my son and I would play football out in the backyard, he'd throw the ball to me, and if I had to run and go get it, it would cause like complete body fatigue. I would just run to it, and then I would just have to stop and collapse, and I would just stop there and wait until I recovered. And for a long time, I kept going back to the cardiologist saying something's not right here because I can't recover. I shouldn't be feeling it this way. And then I started jumping on the internet and looking about things about what makes you breathe fast and why do you and so forth. And then I realized it was connected to the diaphragm, and then so forth. And then I found my way to the phrenic nerve in finding out that what the phrenic nerve is. And while I was learning about the phrenic nerve, that's when I came across the research that Dr. Kaufman and his colleague from California, whose name escapes me at the moment, I had read about their work. During my cardiac surgery, it's possible that somehow the phrenic nerve was damaged. And as a result, after going to Brigham and Women's Hospital in Boston and having a sniff test done, they determined that the left side of my diaphragm was paralyzed. I took that to mean that the left phrenic nerve had been damaged during the surgery, and it wasn't going to fix itself. And I was very lucky that I found Dr. Kaufman, who had done the work like this. That's when I reached out to Dr. Kaufman for the first time, somewhere around 2020 or 2021. When I decided that this is what I wanted to do, I was in touch with Dr. Kaufman's office, and like I said before, everybody that I was in touch with, especially Brittany, were informative, compassionate, responsive, and I didn't have, and I'm just like, I'm going to New Jersey and I'm getting this fixed, and that's all there is to it. As I got closer to the surgery, I got a little bit scared because I said to myself, I'm just going down there and he's going to open me up, and don't I have a problem with this? So I was a little bit apprehensive, but I mean, that's true of any kind of surgery. But that still didn't stop me. When I got down there and, I was in place, I showed up in the morning and I saw Dr. Kaufman in the morning and his staff. I felt fine. I felt good. I was comfortable. I felt safe. I mean, I'm at a hospital. I've got doctors and nurses all around me. I wasn't worried. The surgery, I guess it was on a Friday, and I stayed through the weekend, and I think I was discharged on Monday or Tuesday. So I was in the hospital maybe for 3 days, and it hurt. My chest was sore. My right leg was sore. That's where they snagged the nerve. That was a little bit scary, and I had a little trouble dealing with the pain, but that's just part of the process. They tried to manage my pain as best they could. The hospital did, and I was grateful to them. But I can't expect that it's going to be painless. So I just had to suck it up as best I could just to get through the recovery. So I was there about 3 days, and then I was discharged, and we stayed at the hotel for another 5 days. And then I went back to Dr. Kaufman's office. He examined the sites of the surgery and was satisfied that I was healing properly. I was doing my breathing exercises, and I was taking some walks, and he was satisfied that I was doing the therapy properly. So I was able to go home after that. It was a really, really good experience. I can do whatever I want now. I can run and catch the football. I don't collapse. I don't get tired. I've been able to get back to running. I can do anything I want in the yard. As far as I'm concerned, I have no restrictions. And I'm very happy to tell people about what I went through. I can't imagine how many people could benefit from this. It doesn't seem like such a big deal. A nerve graft of the phrenic nerve to help your diaphragm. Well, that's not that big a deal. We're not replacing an organ or anything here. And I can't imagine how many people could benefit from this kind of thing if it was a more widely used procedure in the medical community. If you've got a condition, the solution is there. Dr. Kaufman's figured it out. Then go ahead and do it. If a person is able to put the week for the therapy after the surgery, and staying near the hospital, and then do the breathing exercises and follow the therapy properly, they can get their life back. And there's no reason not to, because the alternative is you can lose your breathing capacity for the rest of your life. Why wouldn't you?